Good evening to all of you. I am Dr. Alka Sen, practicing gynecologist at Agra. When we listen or when we think about the pregnancy is a very interesting journey in the life of a lady because with the news that the lady is pregnant or the bahu is pregnant, there is a very good feeling of everybody, even in the pregnant lady, along with the family member, because it gives a very interesting, a very anxious, and a very soothing feeling to all of the members of the family. And this journey of the pregnancy is of 9 months and having a lot of symptoms, good symptoms also and bad symptoms also. So, approximately the time of the pregnancy is 9 months, and in 9 months, there are from the day zero till 9 months, there are the different kind of the discomfort in the journey of this pregnancy. But a very common and very much, very much talked, and rather it is a sign of a pregnancy in the previous olden days, because there are no diagnostic tools for for the confirmation of the pregnancy, and that is the most important sign and symptom is the nausea and vomiting. So nausea and vomiting, because of any reason, in olden days it has to be taken into consideration that the lady is pregnant. So, s- this nausea and vomiting, it is very common in the first trimester of pregnancy, that is in the first. But in some cases, it may prolong till 5 months, 7 months, or in some cases throughout the pregnancy. But it is very common, like in 90 to 95% cases, the pregnant lady used to suffer this nausea and vomiting during first trimester. In 5 to 10% of cases, there is no symptoms. In that case, the lady is very much anxious that why doctor I am not having any silent symptoms like nausea and vomiting, because it is that common that it has been taken into consideration that the nausea and vomiting is part and parcel of the pregnancy. So today I will talk about this nausea and vomiting that is normally called morning sickness, and how can we control this morning sickness, how can we fight with this battle of morning sickness by the selection of different kind of food. So I'm going to tell about something about the food and the selection of the food, what you should take to control the morning sickness. If I talk ideally, then there are certain food which helps control the morning sickness. For an example, soft food like smoothie, yogurt, lemon, ginger preparations also. These are ideally called that they can fight the battle against the morning sickness. But morning sickness is of such, it is very much individualized and very much personalized. It is not necessary that every lady can be affected or can be get relieved by all of these food articles which I have told just now. They have got their own taste, they have got their own perversion, they have got their own smell senses, and they have got their own taste. And because of this personalized choice of the selection of the food, nothing can be say as a thumb rule that you should in the morning sickness you should take biscuits, you should take yogurts, you should take banana or apple like of fruits. So I should tell what is the basis of the morning sickness and how can we control this basic fundamental. The main idea to control the morning sickness is to maintain the blood sugar level in the milli-interna of a pregnant lady. Means we should take something or other according to our taste regularly, that will maintain the blood sugar level in a pregnant lady. And if you are able to maintain the blood sugar level throughout, so this feeling of nausea and vomiting can be controlled up to an extent, not 100%. So the first and the foremost rule to control the morning sickness is the small frequent meals, and the meals should be of your choice, that should be of your taste, that should be of your own feeling. The pregnant lady should not be imposed by any of the ideal diet, that you should take roti, dal, chawal, and the doodh and this and that types, because the family member, they feel like that the lady, the bahu is pregnant in the home, so now she is in a privileged class and she should take best of the nutrition, and they forced to take all the nutritious diet. And at that moment, the pregnant lady in the first trimester, she is nauseating, her feeling is very bad. There is a perversion of smell, perversion of taste because of the hormone of the pregnancy. So if she is being forced to take the food article as the family member wants, she will feel more nauseating, she'll feel more agitated, more frustrated, and the feeling of morning sickness increases. Because the morning sickness is a very bad feeling of an individual, and if she will get a good sympathetic attitude from the husband or from the family member, the morning sickness dilutes itself. So, by this, we can get there are two very important aspects to control the morning sickness is the small frequent meals, and the meals should be of your taste and of your choice. And secondly, the sympathetic attitude. Sympathetic attitude means a little bit pampering. The third thing which is important, that the hydration of the cells, and this hydration of the cells taken with a small amount of the fluids frequently. Always avoid to take the very large amount of the fluid at one time, because there is a feeling of fullness in the stomach, and as soon as you take a large amount of the whatever it is, solid or the liquid, so the stomach throws out. And if you start vomiting, then the lady is more agitated, more frustrated, and feels that I should not take the further meal. And this refusal to feed again increases the feeling of this sickness, the feeling of nausea, and continuously, if you are nauseating and if you are not able to maintain your blood sugar at that moment, you will start vomiting. And at this stage, no medicine will work, because this is a vicious circle. Vicious circle means you will start at morning sickness, then again a nausea, and nausea, you have taken the food which is an ideal, which you don't like exactly. You have taken that food, and by taking this food, you have vomited out. So, whatever in your stomach, that has also been thrown out outside. So, you are with the empty calories. The metabolism gets reversed, and the catabolic process starts, and this catabolus again give you the feeling of nausea and the vomiting, and this vicious circle starts. So at that moment, what you really need, that you need something which can increase your blood glucose level immediately, and you have to maintain that blood glucose consistently. And if you are able to maintain the blood glucose along with the hydration of the body and hydration of the cells, so that will a very good tool to help you out to maintain your morning sickness feeling and feeling of well-being. uh, During my talk, Ruchita wants to know that she is 8 weeks pregnant and she don't feel like to eat. If I eat, keeps vomiting. Doctor has prescribed some medicine, some tablets of a little control that will not harm my baby. Okay, fine. This is actually the curiosity which every pregnant lady have, that this vomiting and this nausea feeling. I'm not able to take anything, and if I'm taking some tablet, that tablet, because that is a taboo, that is a myth, that any of the medicine you should be taking in the pregnancy will affect the baby. But it's not like this. There are some safe medicines also which can be used and which will be the beneficial, but it should be given by the doctor only. You should not take your own decision to take those tablets. Preeti wants to know that how many times vomiting is normal during pregnancy. For me, it is 3 to 4 times of the times of the vomiting in a day. Preeti, it's a very good question, because this is not a matter of how many times you are having the vomiting, but according to me, 1 or 2 or 3 vomitings should, if it is there, one should tolerate it, because the vomiting gives you, after the vomiting, you feel like a cleanliness inside you, because you are not able to take anything. So the gastric juices, the acid that collects in the stomach, and if you vomits it out, that whole of the stomach gets empty, and your acid will become neutralized. I mean to say, like, your whole of the acid that is collected in the stomach, that has come outside, so you feel good. And immediately after that you have vomited out, you should take a small amount of something which will really increase your blood glucose level in a very small quantity, so that your cells, which are empty, which are hungry, which are thirsty, should get something, and they get normalized. So you keep on taking the sips of water, maybe a glucose water, maybe you can add the lemon in it, and a small pinch of salt in it. Hansa wants to know that when should I be concerned about the vomiting during pregnancy? Very good question, Hansa. That is a very intelligent question, because if you know that this vomiting is the part and parcel of the first trimester, so we really educate our patient that to tolerate this nausea and vomiting feeling, and not to be get over conscious or over concerned about it. And you should not make any panic to you and to your family member also. But what is the limit? The limit means that you are not even able to take the sip of water, and you are consistently vomiting out whatever the solid or the liquid you are taking. That will really gives you the negative metabolism, that is called catabolism. As I've already told you, this catabolism, that is a very dangerous for one's life. At times, it may be life threatening also. So, if you feel drowsy, if you feel very low calories, and if you feel like that now your energies are so low that even you are not able to perform your daily routine activity, you should immediately contact your doctor. And at that moment of time, if you are not able to take anything orally, you should go for the IV fluids. That will maintain your blood glucose level, and as soon as your blood glucose level is maintained, you will feel good, and even you are able to take anything whatever you want according to your choice. And wants how long vomiting will stay my weeks pregnant, still keep doing vomiting. As I've already told you to start with my talk, that not is 90% cases, it is only confined to the first trimester of the pregnancy, that is 3 months. But in some cases, it may extend up to 5 months. In some cases, even 7 months, or in very, I mean, like 2 to 3%, or maybe say 5% cases, it may extend pregnancy period. So there is no cut short time that you will stop having this feeling after this and that. Like in most of the cases, it is 12 weeks, but in certain cases, it may extend up to the 14 weeks. But the reassurance is must. The attitude from the family member and the husband is must. That helps more than the medicine. Aarti wants to know, can vomiting cause miscarriage? Very intelligent question, Aarti. There is a very important question in the sense, as I've already told, that if there is excessive vomiting, that is called hyperemesis gravidarum. Because morning sickness is a very light term. Morning sickness means you are feeling nauseating, you are not able to concentrate in your work, and you are disturbed. Your thoughts are flying here and there because your blood glucose level is not maintained, your brain is not working properly, and your minds are matlab, fogging. There is a fogging of the ideas. So in that case, you are suffering from this morning sickness to the hyperemesis gravidarum, and your metabolism is getting changed. And if at that so you have not given any attention to yourself, or the family member has not given attention to you, it is possible that after a long catabolism, your baby may get aborted. So, already told, this should be taken into consideration that it is a part of pregnancy, but it should not be taken in an overconfidence that okay, it happens and it will go by the end of the 12th week or the 13th week, and you are excessively vomiting out, you are not able to take anything, and your whole of the system is getting down. So miscarriages has been seen in hyperemesis of gravidarum in a very very negligible cases. Not to me, I have never seen. I am doing practice since last 35 years. I have never seen miscarriages where the cause of the miscarriages is because of the vomiting. Because these are very neglected, and it is seldom found that no one is so much neglected for himself, or the family member are not such that they are not paying attention to the females who is doing the excessive vomiting. So I was talking about the morning sickness that helps to control the morning sickness are, um, first of all, we should avoid what we should avoid. We should avoid normally the heavy foods. What do we mean by the heavy foods? Heavy foods means they are difficult to digest. because already there is a hormone in the that is called progesterone, and this progesterone hormone that is called the pregnancy hormones, which is in the axis at this time, that causes the you can decide it yourself. Okay, I think there is some problem, technical issue. I think everything is okay now. Okay, fine. Should I repeat what I have told? I will repeat in a short sentences that we should take the food articles in a very small quantity at one time, means a small amount at regular interval. Whatever you like most, that should be in a small amount. The second very important thing is about hydration. Again, I would like to emphasize on it that you should not take a large fluid at one time. Otherwise, because of the low gastric motility, your stomach will throw it out immediately, whatever you have taken. So, take the things into the sip that it gets absorbed in the body easily and your cells gets rehydrated. So these two things are very important: small meals at frequent interval, and it should not be taken at one time with the full stomach. It should be in the half stomach fill. We should feel like hungry if you want to repeat it in the next 1 hour or in the next 2 hours. So these two very important. The hard food, I have told you that the food which are very difficult to digest should not be taken. The As far as the junk food is taken, uh, most of the time I have seen ladies, they have craving about the fast food in this period of time. So I advise those ladies to take all these junk food, because our main aim will fulfill the calories of a day. So if she is taking with good feeling and able to digest that junk food also, so she should allow to take those junk, but again in a small quantity, so that she can maintain the total calories which is required for the daily routine activity. But she should take a glucose and the lime water as well, so that she should get the good glucose in the body. A very important thing that again I would like to emphasize, that the sympathetic And the pampering attitude of the family member and the husband is utmost important, very important, and it should be done, and it is a teamwork. The husband, the family member, doctor, and your feeling. This is a teamwork. If we are doing the teamwork, and that is a best modality to fight against, because the light can only be taken care of if your attitude is positive and you feel like that you have to tolerate a bit of perversion of smell, of feeling, of the taste that happens. If it is too, then it doesn't mean you are suffering uh, from any disease. So now I would like to summarize my talk. What should the take home message is? One, a small frequent meals. Number two, you should rehydrate yourself, your body, your cells with small amount of sips of glucose water with lime and a little bit of salt. Number three, the sympathetic attitude of the husband and the father. Regular visits to your doctor. Don't take any medicine of yourself. Contact to her and take all the prescribed medicine as doctor says. And if the vomitings are takes IV fluids under the supervision of the dog, many of the patient wants that they will have the IV fluids at home. I highly did, because everything, whatever the medication, should be taken with the. So, my dear pregnant, is happiness that brings you a news information of a new coming member. You should greet it, you should welcome it. Don't be get depressed by the morning sickness. Don't be get frustrated with the morning sickness, because a very light battle and you have to win it. Thank you.